Hey folks, so today we're talking about pelvic floor therapy. Pelvic floor, and I'm going to be specific and say physical therapy. There are options for occupational therapy, but let's just talk about it in the rehab sense. We're going to talk about physical therapy because that is what I am. Now, when you think physical therapy, you probably are thinking whether it's massage or stretching or exercises. And so the question kind of becomes, can that happen there as well? Yes. And so with pelvic floor physical therapy, we are going to be doing very similar things of assessing the way the muscles would go about. Now, it's going to be a little bit different. It should be done in a private room. It should be assessed by touch and looking at motion, things like that. But I'm going to say it and I'm going to keep saying it. It comes down to what you're comfortable with. The question becomes, why do I need to go see a pelvic floor therapist? Okay, for one, it may be beneficial to see one if you're having any kind of leaking. What leaking do we talk about? We're talking about leaking of urine, leaking of feces, leaking of gas. And when we say leaking, it means that it comes out of you when you don't want it to happen. So yes, you have that pad that you carry with you just in case, that extra pair of underwear. Yes, that would be considered leaking. That is a reason to see a pelvic floor therapist. Okay, if you're having pain, this could be pain with intercourse. It could be pain when you're going to the GYN exam, not just the pressure, but pain, like you're dreading it, like you start to curl up and cringe at the thought of them even coming near you with that speculum. Yes, that would be a reason to see a pelvic floor therapist. And I'm going to come back to that pain part because there's an additional portion there. If you have constipation, yes, you're forcing to get it out. It's only coming out once every few days. You have to take all this medication to get it out. That would also be a reason to see a pelvic floor therapist. If you can tell, it has a lot to do with anything that happens from the front to the back, along where we wipe. It's important. I would even garner to say, when we talk about pain, we want to add anything that happens kind of below the diaphragm where your breathing happens to about the knees. Generally, when there's a pain happening within that area, you can call it lumbopelvic pain, lumbar, lumbo, pelvic, pelvis, where all of this is happening. That would be reason to see a pelvic floor therapist. Now, another area where it's good to see a pelvic floor therapist is while you're pregnant, if you're having any kind of pain issues and things like that as well, but sometimes just it can be helpful for just learning how to go through your pregnancy successfully. You can also, and you should probably also see one after you're pregnant. So after you've delivered. This would be helpful for things like if there was any changes in the way our body was when we were delivering, any tearing, or if we had prolonged labor or complications with labor. These types of things can take they can take their toll on the pelvic floor muscles. The muscles are being stretched and pushed and pulled and things like that. A lot of people feel like, oh, if I delivered by cesarean, then oh no, my girl's fine. Yeah, she may be, as well as she may not be. She may benefit from a checkup as well, just to make sure that everything is going back to the way it was before, or as close to it as possible. We know that once we've had that baby, we're changed forever, indelibly. There's a mark on our hearts, our bodies, our everything. Okay. And for some of you, it's just because, well, you were told to go and you have no clue what it is. None of these things sound familiar per se, but you were told to go. Um, and so you go to a therapist. Oh, I forgot to add one. If you're going to the bathroom very frequently, like every hour, every 2 hours, yes, that's another reason why you would want to go see a pelvic floor therapist. Now, the question becomes, how do I figure out the right person to go to? Because just because they are physical therapists does not mean that they specialize in pelvic floor therapy. And not all pelvic floor therapists are going to be equal. And I say that to mean when you are looking for someone, you want to make sure that it's someone who can do internal assessments as well. So some people will say they're pelvic floor therapists or they work with the pelvic floor, but everything is going to be external. Depending on what you need, you may need someone who can go and do an internal exam. So it kind of leads me to talk about what to expect when you go see them. And this is where it comes back to what your comfort level may be. Some people are going to be too uncomfortable to do anything internally. And so the skill of the therapist will be to take what they can from the external assessment to understand what can be happening internally and give prescription that way, whether it's exercises, strengthening, relaxing, even just simple things like cueing in and getting you aware of those muscles. Because sometimes with injury, sometimes with over time, whether it's post-cancer treatments, whatever the case may be, sometimes our awareness of our muscles and our ability to control them will change. And so we have to find new patterns. And this is where the therapist can come in to help you learn the new pattern, whether you need to relax it more, whether you need to strengthen it more, whatever the case may be. Um, you'll also want to look for someone who has at least a working knowledge of pelvic floor and orthopedics. And when I say orthopedics, we're thinking more of what you would traditionally think of for physical therapy in a physical therapy clinic. They're going to be assessing the back and the legs and the hips and things like that, because we know that we can't treat in a silo. We can't just knock out all the other parts of the body and just think about the pelvis and the pelvic floor. Everything is very much integrated. And so we want to make sure that they can take a broader look at you and find the things that they need to help you with to improve the quality of your life. You have a bit of an understanding as to what can bring you to pelvic floor therapy. You have a bit of an understanding of what you should look for in a pelvic floor therapist. Now the question becomes, how do you find this pelvic floor therapist? The Professional Association for Physical Therapists, also known as the APTA, they have an Academy of Pelvic Health. And so if you go to aptapelvichealth.org, there's an opportunity to find pelvic floor therapists by your zip code. That's one area that you can get that information from. There are also other companies that are very big in pelvic floor rehab and education for us as clinicians. And so they also host directories. One of them is called Herman Wallace. And so if you go to hermanandwallace.org, you can find their list of their directories. You go to look for their directory as well to find pelvic floor therapists. And there's another one that comes to mind. It is Pelvic Guru. With Pelvic Guru, you're looking at international, and you're not just looking for, or you can find more than just physical therapists or like the rehabilitation portion of it. In some cases, you have surgeons, other doctors. You may have yoga instructors, Pilates instructors, but people who are more focused on the things that are concerning the pelvic floor. So you have a little bit more variety of clinicians, but if you're looking for a physical therapist, then specify the physical therapist portion of it. And the other thing about it is they're international versus Herman and Wallace and the APTA, which tends to be national, so within the United States. Now, just to touch on a few points, we were talking about occupational therapists earlier when I started the video. And what I wanted to clarify was that when we're looking at rehabilitation of the pelvic floor, it can be done by a physical therapist or an occupational therapist. We are both trained in the anatomy of the body, the physiology, how things are going to work. And so our training is going to be to get those muscles to be rehabilitated. It's going to be a little bit different looking at some of the other specialties of yoga or whatever. Not that they don't have knowledge, but our knowledge is going to be different. Our knowledge is going to be clinical based. It's going to be research based. It's going to be based on the anatomy of the body and on our studies of that. So I don't have the links for finding the occupational therapist, but I do have it for finding the physical therapist. And in some spaces, you will have both of them working side by side with patients, and that's amazing. When you are looking for your physical therapist, you want to make sure that your experience is going to be interactive, that they're going to be giving you feedback. They're going to be looking at what you're doing, how you're doing, and then explain to you what it is that's happening and explain what should be happening. So we definitely want to make sure that we're getting the education and the understanding part as we go along in our training, as we go along in our process. Know that it is not a quick fix. Usually the problem is not something that happens overnight. And so it's not going to be a quick fix, but it is worth it in the end. And our aim and our goal is to help you improve the quality of your life. This is Tristan Joe signing out for